I greet you all in the name of our Lord Jesus Christ. And allow me to start by expressing my sincere appreciation to Suzanne here and to Janine Cardmore, who I'm not sure if she's joined the prayer sessions today, but she is a dear colleague that I got to meet here in Neno last year, and to the entire PWRDF leadership for according me this great opportunity to join in today in these prayers. I am very honored on behalf of myself, but also on behalf of the entire organization Partners in Health in Malawi. It's close to 40 years since the HIV/AIDS pandemic, or rather the disease, was discovered. And millions of people have lost their loved ones, and innumerable households and families have been affected in one way or another. And today, as we commemorate World AIDS Day, I want us to look back together and see what our contribution has been towards the fight, towards fighting this pandemic, and how the goodness of the Lord has manifested itself through us to bring light and hope to the world. The theme of World AIDS Day this year is ending inequalities, ending AIDS. This theme was specifically brought about to draw attention to the last mile people, to those populations who are up to now struggling to have access to essential drugs and to HIV services. While the HIV situation is or has been contained in most developed countries, the pandemic remains a major public health issue, particularly in sub-Saharan Africa, where we continue to see the highest rates of HIV. And when we try to understand why is the HIV/AIDS situation not improving at the same rates as other developed countries, the answer is not so hard to find. All you need to do is walk in the streets of our many towns on the continent, and you will see how poverty increases the risk of our brothers and sisters in these neighborhoods. You will see how desperation for day-to-day survival and how low education and low knowledge of the means to prevent HIV infection is still pushing so many of them to contract this virus. The story of how inequalities of various types directly impact on people's health is something we all know very well. But allow me to share with you all our journey from Neno district in Malawi. So very briefly, Malawi at the moment has over 1 million people who are living with HIV. Neno, this very small district where Partners in Health is working, we have currently over 8,000 patients that are living with the disease and are supported through our care and treatment programs. When PIH was starting in the district in 2007, there was so little to point at in terms of the health system itself. There was no district hospital. The small health center that was there was severely understaffed. It only had 2 nurses. They would shift, one would work during the day, the other one would work at nights. There was only 1 medical assistant. There was only 1 ambulance, and its purpose was to ferry especially pregnant women over a distance of 80 kilometers to support them with safe delivery. In that first year, PIH invested over $2 million into the construction of Nhlema District Hospital. The organization also rolled out the first community health worker program, which selected committed members of the community to accompany HIV/AIDS patients on their journey towards health. In that first year, we managed to enroll 480 patients, and we placed them on the antiretroviral treatment, which was a huge leap from the initial 5 patients that we found in the district when PIH was joining. Since that time, PIH Malawi has worked so hard to improve the HIV/AIDS services coverage in the district. We are currently using an integrated platform, which we call Integrated Chronic Care Clinic. It's an approach where patients who are primarily poor people don't have to travel to the health facility a number of times in a week or a month, which is what used to be before PIH came into this space. Then patients who had more than one condition would have to visit the facility twice or more, depending on the number of illnesses that they had. So as each disease was being managed under different clinics, which were operating on different days and sometimes from different health facilities. This was proving to be a huge burden on people who are already sick and vulnerable to have to travel on foot long distances, sometimes of more than 15 kilometers, to access treatment services for one illness, and then do a similar trip, maybe the following day or the following week. The Integrated Chronic Care Clinic was brought in primarily to solve this challenge for patients. This is a mobile clinic of specialized service providers in HIV care as well as non-communicable disease care, which includes care for hypertension, diabetes, heart condition, epilepsy, asthma, mental illness, including depression. All these services at the moment are being provided under one roof, with a patient literally moving from one station to the other. During these clinics, we also offer screening services for tuberculosis, cervical cancer, and family planning, among others. Thus, by the time the patient is walking out of the facility, they will have been checked and supported on a number of conditions, and they don't need to come back to the facility until the next appointment. When they get home, they continue to receive care, but now under our community health workers, who are assigned to a number of households ranging from 20 to 40 households that they visit on a monthly basis. During those visits, they provide health education, they screen and refer for a number of conditions. They also provide psychosocial support to those who are chronically ill. We have a total of 1,228 community health workers in Nhlema, and they cover almost all the households we have in the district. They regularly check up on all HIV patients. They visit on a daily basis those who are in their first year of treatment and make sure that they are getting all their medication and monitor on any side effects they may have. They accompany the HIV patients to the facility for their appointments to help them navigate the health system, but most importantly, to provide additional information that usually helps our clinicians to make better decisions about the patient's treatment. Using these two innovative ideas and of the integrated chronic care clinic and our community health workers who provide accompaniment services, Neno HIV program has over the years registered success throughout its existence. This success has been seen in patient enrollment. We currently have more patients, as I mentioned earlier on, over 8,000 patients. We've also seen that there is good retention rate, but also monitoring of patients' viral load. From 2013 to 2015, Neno district had the highest one-year survival and retention rate for HIV patients compared to all other districts in Malawi. The Department of HIV and AIDS reported Neno HIV program in the top 4 districts in Malawi to have the highest one-year retention and the 3rd district with the lowest rate of lost to follow-up. Moreover, viral suppression in Neno has reached the highest rank in Malawi. In 2019, the viral suppression rate of the HIV cohort was over 95%, which put Neno district on the top to achieve 95% viral suppression rate. For us here in Neno, the theme of end inequalities and AIDS has indeed been tested, and we have found that it is possible to end AIDS. And the most practical way of attaining that is by steadily addressing the systemic injustices as well as the social, the economic, environmental, and structural inequalities that lead to intergroup differences in health outcomes, both within and between societies. We have also proved that it takes an entire community of people coming together, each with their own gift, with their own talent, and their own function, all operating under one body and one spirit to achieve the utmost outcome like the one achieved in Luke 5, verse 25. Now, achieving these outcomes that I just outlined is not an easy thing. It requires a lot of investment and resources to sustain such programs. And we are grateful to God that over all these years, our work and our approaches have been supported by many well-meaning individuals, foundations, and institutions, including PWRDF. In 2019, you joined our cause and you came in specifically to support our helpers, our community of community health workers. And you are supporting the helpers who are doing a tremendous job of uplifting and linking the sick to where they can find help and healing. As in Luke 5, verses 18 and 19, these are the people who literally walk the journey with the patients, helping them to navigate the health system, which can be very complex at times, to get to the exact point where you will get the right kind of help. Like the paralytic in Luke 5, our patients need all the help they can get. And in the case of Neno, it is these community health workers who are fulfilling their ministry. The more I reflect on the work that our community health workers do in support of the HIV program, the more I see similarities with the group of community members we see in Luke chapter 5. We know very little about who these people were. We don't know their names, the chapter doesn't mention. Their personal situations. We don't know anything about how far they traveled to get to where Jesus was. All we know is that they were compelled by great compassion towards this paralytic patient. And it is this compassion that propelled them into action. I love what James says in chapter 2, verses 15 to 16, where it says, if a brother or sister in faith is poorly clothed and hungry, and you leave them saying, goodbye, I hope you stay warm and have plenty to eat, but you don't provide them with a coat or even a cup of soup, what good is your faith? As believers, God requires us to act and not just talk. And what a great example of faith is manifested through actions we see in Luke 5, as well as through our community health workers, and also through the support that we as partners in Health Malawi have been getting from PWRDF. Our community health workers, just like the men in Luke 5, have great tribulations of their own. They themselves face similar challenges of poverty and illness. The majority of our community health workers are women. Many of them are widowed and living with HIV, struggling every day to make ends meet, yet every single day, they choose to extend a helping hand to others who are equally less fortunate in their communities. The Goat Seed Project, therefore, is going a long way in supporting some of the needs that our community health workers themselves have. At the moment, the whole first line of our community health workers have received their seed package of 3 goats each. Many goats have already started reproducing, and some second line of community health workers have started receiving their goats. We pray that God will bless all the goats and multiply them, so this seed can reach all our community health workers in good time and be a source of provision for their household needs. I want to finish my reflections with Proverbs 19, verses 17, and I read, whoever is kind to the poor lends to the Lord, and he will reward them for what they have done. My prayer today and for all the days to come is for the Lord to reward all the workers in his vineyard, to reward all the community health workers and all other volunteers who are supporting his work and his people. And most importantly, to reward you all, brethren, in PWRDF for the work you are doing around the world, and to us here in Partners in Health Malawi. We are very grateful. We are very thankful. Thank you.